Please subscribe to the channel by hitting the link below. Today we're discussing African men and American men on battling depression. We'll cover views, consequences, and acceptance. Subscribe for more on mental health. Many African men see depression through cultural and spiritual lenses, not just medical ones. Traditional masculine norms stress strength, stoicism, and endurance. Phrases like man up and be strong shape how emotions are handled from childhood. This communal view often hinders open discussion of mental health. Persistent sadness or unexplained physical complaints are frequently attributed to spiritual causes, generational issues, curses, or life hardships to be endured rather than diagnosed. Formal clinical labels such as depression are sometimes rejected, traditional healers or religious spiritual support than from professional mental health services. American men more commonly encounter depression framed as a clinical condition within an individualistic culture that has seen rising public awareness. Masculine habitations of self-reliance, handling it yourself, still discourage open emotional expression. In men, depression symptoms may appear as irritability, anger, risk-taking, or physical complaints rather than classic sadness. Therapy, counseling, and medication are more visible and accessible through healthcare, workplaces, and campaigns. However, many men still minimize their struggles or delay seeking help. Untreated depression has serious consequences. It can strain relationships and impair work. It may lead to substance use and social isolation, and it raises the risk of suicide. In African contexts, there are additional barriers like limited services and stigma. That equates mental distress with weakness. American contexts show higher formal treatment rates over time, yet men still access care at lower rates than women and carry elevated suicide rates. Externalizing behaviors like anger and withdrawal are common, making it harder to recognize early. Acceptance of formal diagnosis and professional help remains lower among many African men due to cultural stigma, preference for spiritual or community solutions, and concerns about appearing weak. Awareness is growing in some urban and younger circles, but traditional norms continue to shape responses. Among American men, acceptance of therapy and open discussion has increased with public campaigns, yet residual stigma, cost, and masculine ideals still limit uptake. Informal support from friends or family remains important. Cultural frameworks strongly influence how men recognize, name, express, and respond to depressive experiences. Shared pressures around masculinity and undertreatment exhilarate distinct moral, spiritual, infrastructural, and individual differences. Neither approach ranks to superior costs of silence and the value of support systems that fit the cultural context of the men involved.